Great. Well, I'm going to go ahead and kick it off. So I want to just thank everyone for joining us this morning. I appreciate everyone taking just a few minutes out of their busy schedule to hear from Blue Cross Blue Shield of Michigan. We have Nicole Wingate with us. So welcome, Nicole. So what we're going to do today is try and keep this to 15 to 30 minutes and just kind of get into some basic highlights of Blue Cross Blue Shield, their products this year, some of the tremendous opportunity for you as agents to be using these products, of course, with a very recognizable household name that always helps. So Nicole's going to share some of the highlights and high points that agents are using Blue Cross for, the reasons why they're selling Blue Cross. And then after that, we're going to have a couple just basic industry questions we're getting from agents that we'll talk with Nicole about. So again, thank you for joining us. And with that, Nicole, I'm going to turn it over to you.
Hi, everybody. Nicole Wingate, been with the Blues for 15 years now. Time flies when you're having fun. I'm going to jump right into highlight presentation. I put a couple of slides together to give you a review and highlights of the plan. And I'm going to share my screen right now. Okay, quick review of our plans here. Okay, so these are our plans for 2023. We have our PPO plans. That's 4 PPO plans. The Blue Essential is one of the most popular plans, and we'll just dive into that a little bit more. It's a 0 premium cost share for the member. We have our HMO POS plans, 5 of them there. One of our most popular, Prime Value, which is also a 0 premium through all regions. We'll also talk about Elements, that's redesigned, which is our only plan that does not include prescription drugs. And then our 2 local HMO plans. All right, couple of quick highlights again. We have richer core benefits. We stabilize and improve offerings, lowering MOOPs, eliminating medical deductibles. You'll see that, lowering premiums. Remember, all of our plans include the dental benefits embedded in the base plan. So it has the $1,500 dental allowance and $150 vision allowance in all base plans, except for connected care for the vision allowance, but we'll talk about that. Our medical health benefits went from $40 to $20 copay. And then we have an expansion of our caregiver support program to all of our plans. Also, Elements, we redesigned Elements, again, cutting down that cost share for the member. So it's a 0 premium, 0 in-network deductible. We'll talk a little bit about our local plan. We are utilizing a rich formulary for all HMO POS and our PPO plans. That makes it easier for our agents, our members to look up prescriptions. This is excluding community value and our local HMO. And then we also reduced by $9 to $10 tier 3 90-day mail order. So cutting that cost share for the member. And then one of the things that I'm most excited about is our OTC. You get from anywhere from $25 to $100 each quarter, and you don't lose it. So you can use that until the end of the year. That means it rolls over. Let's talk about our PPO real quick. Some highlights with our PPO. See a lot of zeros here. 0 medical deductibles for all plans. That's huge. 0 PCP, 0 copay for virtual PCP and behavioral health services. All of our plans come with emergency and urgent care worldwide, with that worldwide emergency transportation as well. 0 prescription drug deductible for all plans. And we also include hearing exams, $750 per ear for hearing aid allowance. Just to talk about our PPO Essential, from last year, you see all of these things have been reduced or removed. From Region 3, they had a $10 premium. So again, that's $0 for the premium for all regions. We reduced the MOOP by $800, which is huge. We talked about mental health from $40 to $20. And again, utilizing that same formulary. Now you remember our PPO is in the whole state of Michigan. So that's all 83 counties. You live in Michigan at least 6 months out of the year, you have Part A and Part B, you're eligible for any of our PPO plans. So this is a snapshot of all of our PPO plans side by side. We talked about the Blue Essential, which is 0 premium. All of our plans come with prescription drugs, as you see, 0 for primary care physician. These are our different OTC allowance. And again, you get that every quarter, and that's rollover. Our PPO Assure has a flex card. This is a new pilot for this plan. If it goes well, we are looking to expand that to all of the plans, but it gives you that OTC for food and groceries and OTC items for $25. That same card gives you $75 for dental, vision, and hearing. And that is rollover as well. So each quarter you'll get that and you can use that until the end of the year. Medical deductibles are low, $0, and our out-of-pocket maximums are pretty low as well. Let's talk about our HMO POS. Some highlights here, again, seeing a lot of zeros here, and our members love that. 0 monthly premiums, plan available, 0 medical deductible, all plans, 0 PCP. So again, seeing a lot of zeros there, cutting down that cost share. All of our plans include that $1,500 dental allowance for preventive and comprehensive, also the $150 for vision allowance. So all of our HMO POS plans, this is the service area, 70 counties highlighted here, one of the largest HMO plans in the state. As you see here with our prime value, we eliminated a lot of cost share for the member again. We removed that $280 medical deductible for Region 3, bringing all medical deductibles at $0. We removed that $50 Part D deductible as well. So as you see, we are really cutting the cost and listening to our members on what they feel that is important. Talking about our community value. Now, this is a unique plan. You would see, so this is in the 7-county area. So it would be the Genesee, Livingston, St. Clair, Macomb, Oakland, Wayne, and Washtenaw counties. So members must live in one of those counties to be eligible for this community value plan. So with this plan, you can see there, you pick a primary care physician, and it's around 880 primary care physicians to choose from, but also can use the same network as the HMO POS for any specialist or hospital facilities. This plan also is kind of unique too. It does have that $1,500 and the $150 for the dental and vision, but it also gives you $100 per quarter for OTC, groceries and OTC allowance. So it gives you a lot of that incentive there, and they also reduce the out-of-pocket maximum. And so this is a screenshot of our HMO POS plans at a glance. So you see that our prime value, $0, all include prescription drugs except for our Elements plan. Remember our Elements plan, so this is for somebody who has credible drug coverage already, like VA insurance. So somebody who has that insurance with the VA can use that for Part D, but also enjoy all the bells and whistles that our Medicare Advantage plan brings. You see our PCP, 0, over-the-counter allowance, and again, that's rollover. Medical deductible is low, $0, and then our out-of-pocket maximum. Now to our local HMO. We have 2. We have the new local HMO, new for 2023. This is in 3 counties. So this is Wayne, Macomb, and Oakland County. So you must live in one of those 3 counties, and you do have emergency and urgent care worldwide with this plan, but it does not have the POS. So if you go out of the state of Michigan, you have the emergency and urgent care, but don't have that POS to see for routine care. So this plan is for somebody who doesn't travel as much. They work with Ascension and Trinity hospitals. I have a slide on that to show you, give you a glimpse of the hospitals that's in the network here. $85 per quarter for OTC allowance. And then this is the plan snapshot here. Again, a lot of zeros. This is actually very similar to our prime value plan, but only in the narrow network. So the Macomb, Oakland, and Wayne County. And then lastly, our last HMO plan, Connected Care. This has been around for a while. This is in the 11 county area shown here on the map. So you must live in one of those counties at least 6 months out of the year. I believe this is the lowest out-of-pocket maximum plan that we have at $3,800. It has a 0 medical deductible, 0 pharmacy deductible, and I believe it is $58 for this plan. These are the hospitals where our 2 local HMO plans that you can go to. So these are the Ascension and Trinity hospitals. So your St. Joe's, it's St. John's, Providence Hospital, St. Mary's hospitals. Skimming right over to our buy-ups here. We're really excited excited about this because, you know, in the base plan, you already get $1,500 for dental. So if you combine that with this, they opt for the optional supplement buy-up, they'll get additional $3,000 for dental allowance. Same thing with our vision, they give you $250. So if you combine that, that's additional, that'll be a total of $400, except for Connected Care does not have that vision. So you would have to buy up for that. All of our buy-up include dentures, bridges, and implants, which is huge. And as you see, the price point is around the same. So you don't have those different variations of price points there. So our PPO is $20.50. Our HMO POS is $20.30. There's no waiting period, no dental deductible. If you need it for this year, but you don't need it for the next year, you can always cancel it. Our PPO and HMO POS plans have the in-network and out-of-network. So you can go to both, but of course you'll save money if you stay in-network. And we go through Denimap is the provider. Just a couple of things here. The dental network, again, you can go to mibluedentist.com. We have three types of provider options. We have the in-network, which is tier 1, you'll pay the lowest cost share. Out-of-network, we have 2 provider types. You have Blue Par, which members, the part provider who agrees to participate as tier 2 dentist cannot charge the difference between the approved amount and the charge amount and will submit the claim on behalf of the member. And then you have non-participating dentists, which you'll pay the highest cost share. Members must pay the dentist directly and collect reimbursement from Blue Cross Blue Shield. This is just a little example here. As you see, tier 1 will pay 100%. Tier 2, they have the co-insurance only that they will have to pay for that. And then our non-participating dentists, you'll pay a little bit the most, the co-insurance plus the difference between the dentist charge and the allowed amount. Run through these added benefits. Again, we talked about the OTC card. This is the card that they get. They can use this at participating retailer stores like Walgreens, Rite Aid, Family Dollar. We have Pop-Up Pals that members must live alone, and it online wellness check-in, shopping support, transportation like housekeeping and companionship for our members who qualify. Senior Link, again, qualifying for our support for caregivers of enrollees. A lot of people are in that situation where they're caring for a loved one. This is expanded to all of our plans. So members and families definitely can get coaching and education and support from this benefit. And then our transportation and meals. If you're discharging from the hospital, we provide 28 meals from Mama Meals, very gourmet meals, and transportation is unlimited trips depending on the county, select county. So you just have to double check that. Our network here is very large. Confidence comes with every card. With our MA PPO and HMO plan, members can access nationwide network of Blue Cross Blue Shield doctors and hospitals that accept Medicare. And remember, we have medical and urgent and emergency transportation covered worldwide. We have our snowbird experience. I have a number here for you. This is for our members that travel to Florida and Arizona, like 6 months out of the year or anytime. They are really kind of like a concierge department for them. They coordinate care with their healthcare providers, connect members to community support, find doctors in the network in Arizona and Florida. That number, that snowbird line number is 1-800-943-9744. Again, 1-800-943-9744. Great benefit. We all know about our silver sneakers. One thing that you may not know, that we will send a at-home kit to a member if they didn't feel like going into a facility, but this is nationwide. So even if they're outside of Michigan, in Texas or Florida or California, they can go to silversneakers.com, put in their zip code, and all of the vendors will pull up facilities that they can go to. I love our Blue Cross Blue Shield mobile app. app. You can do so much. I urge you to show your clients how to get on this after they sign up. Very easy. If they lost their card, they can pull it up right from the mobile app, view deductibles, claims, change their billing. If they want it taken out of automatic, they can do that there. So many things that they can do, and it will stop the confusion and calling customer service because they'll have the answers right at their fingertips. Online visits, I use this a couple of times. It's a zero copay. Connect with a doctor. They can fill prescriptions at the nearest pharmacy. You don't have to go in with your 9-year-old son to emergency or urgent care. And this is a great benefit. Quickly with our supplements here, nothing's really changed here. Lifetime commissions, flexible. Remember, we have online real-time quoting for non-guaranteed issue. And remember, does not include prescriptions. These are our plans here. We have that household discount, 5%. So if you live in the same household as a member, you get that 5% discount. It's not automatically approved, so you have to call in if it's not at the time of enrollment. We have these well-being for our members here for our Medicare supplement plans. We have a dental vision hearing package, only $15.25. So new members can pick this up and receive within 30 days so they can sign up. And then current members can add this between February 1st and April 30th of each year. This is just a snapshot of the buy-up plan here for our Medicare supplement plan. Not as extensive as our buy-ups for our MA plans, but it is a great benefit. Same, if you don't need it, you can always drop it. And it gives you that $1,500, no waiting period, no dental deductible. It's a great plan to add on. And then lastly here, our prescription drugs. We have 2 for this year, upcoming year. We have our basic, which is $90, $94.50. And then our blue premium, which is $112, gives you a $0 deductible, has that 5-tier formulary design, and has a very extensive formulary for our members. So this is my information. Take it down. You guys can email me. That's my work cell. You can call me if you need anything.
Thank you, Nicole. Hey, a couple quick questions from an agent here. We have one that is, what is included in the home kit for Silver Sneakers? Do you know?
Yeah, they used to have a DVD. So I don't know if they upgraded that, but they have a ball, they have stretchies, a stretch band for them, and other instructions that they can use. And I think it's a jump rope in there. They may now include additional devices in there as well. So those are some of the things that are included in that box that you can get from Silver Sneakers.
Okay, awesome. And another question, what is the time frame to add the DVH to existing MedSup policies?
Yes, and I can just go right back to that. Existing current members can add the package to their existing Blue Cross Blue Shield Medicare Supplement or Legacy Medigap plan between February 1st and April 30th each year.
Excellent. That answers that question. I think that's all the agent questions we had this time. We've still got a few minutes, so if you do have some questions, feel free to type that in the Q&A portion. Couple side questions for you, Nicole. As far as the AEP this year, what are you guys seeing? What are you guys hearing out there, both from a carrier perspective and also from your agents in the field?
We're hearing that it's a lot of things are changing. So they're again, and some of this stuff doesn't change over the years. Members are getting a lot of mail, a lot of calls. It's very confusing, and they want some direction. So it's a great thing for agents to reach out just to check on them, even if you feel like they are okay in their plan, just to check out, making sure that touch point, very important to make sure they understand what's in utilizing their plans.
Absolutely. Okay, good. And then maybe just one last question for time's sake. I know obviously you guys have a great program going into this year. I've heard from a lot of agents that they're really happy with the Blue Cross Blue Shield products for 2023. So credit to you and your team for putting those together. And obviously you kind of went through a whole host of details and other information, which is always good to get those refreshers. But if you were to narrow down all of your benefits, maybe into the top 3 or top 5, that you can share with these agents? This is why you would sell Blue Cross this year. This is why you would pull us out, or this is the circumstances and the types of clients you would use us for. What would you narrow down as kind of your top 3 or 5 highlights?
I always have to go back with, and we have that commercial, confident comes with every card. We have one of the largest networks, the whole state of Michigan with our PPO, 70 counties with our HMO POS. Also, I've been hearing from a lot of members and agents that OTC allowance rollover is very unique. Not a lot of carriers have that. And I feel that that is a big game changer also. And that also that we added to the allowance, making it a little bit heftier for our members and able to use that throughout the year and not cutting that off. Also, just the stabilization, cutting down those premiums, lowering medical deductibles, which a lot of members look towards, and can't believe it's almost good to be true. And so they really enjoyed that. And then I think lastly, it's so many, but for time reasons, lastly, I would say definitely the dental implants, bridges, and indentures in all of our buy-up is huge. Mm-hmm. I don't know about any other carrier if they're doing that too, but that is huge. And the fact that it combines giving them a total of 3,000 dental allowance and 400 for vision, it's really special.
All right.
Definitely excited about that.
Yeah, no, those are all great features. Again, those are some of the high points we're hearing that agents are more attracted to this year with those additional add-on benefits. So that's great to hear that. So again, I think that's all the questions we have for today. We got it done in time. So I appreciate you taking us through that. That was awesome. It doesn't look like we have any other questions from the agents in attendance. So of course, if you do have additional questions, feel free to reach out to Nicole or the team at Insurance Advisors Direct. If you're not currently appointed with Blue Cross Blue Shield, reach out to our team. We'll help step you through that process. We'll get you fully certified, ready to sell. Take that back. Looks like we might have one question. If the buy-up dental does bridges, dentures, and implants only apply to the buy-up amount? Are you following that one, Nicole?
I think I know what they're talking about. So with our buy-up plan, you can use that 3,000 towards that amount. Members will pay 25% co-insurance for in-network and 50% co-insurance for out-of-network until that amount, that allowance amount is met.
Hopefully, does that answer your question, Heidi? Okay, looks like it does. And if you need more details, of course, we can talk offline and, chat about that. Yes, okay, good. So, hey, thank you, Nicole. Thank you all for joining in, whether it's live or in a future recorded version of this. And again, we appreciate all your help in the field, Nicole, as we run across questions and need other things from you and your team. We appreciate all the help. And again, we look forward to the continuation of AEP. We still have a few weeks ahead of us. So we wish everyone a successful AEP. And of course, right after that, we'll be into the new year, into the OEP. And if you need anything there, we'd be happy to help. So again, thank you for joining us, Nicole. And thank all of you for coming out to join us as well.
Go Blue.
Go Blue. Sneak that in there, Nicole.
Yes, always.
All right. Thanks, everyone. Have a great rest of your week.
Thank you. Bye-bye.
Bye now.